Hey everybody, welcome back to In Bed with the Millennial. I'm the Millennial Javeda Bay, and this is my bed. And we are still talking about how sex ed is more than just the act of sex. And last week I talked about sex ed in the law. This week I want to talk about sex ed in the medical field because we need to. We really need to. And for a lot of reasons. Now, I'm not saying that we need to talk about it because everybody needs to become a doctor. That's obviously not the case. I'm saying we need to talk about it because there are things that doctors don't tell us, things that doctors aren't taught, and things that if we knew, we could better understand our bodies a lot more. So, sex ed can fill that gap. And that's what I'm going to do today. I'm going to help you fill that gap. So, did you know that for most medical programs in the US, the doctors don't get sex ed training. They don't go through a specific class that teaches them about the sexual aspects of medicine. They might just get a couple workshops here and there, but it's never a deep dive in how all these aspects are going to show up, understanding all the specifics of things, unless you specialize in them. So if you're a doctor that specializes in sexual dysfunction, then yeah, you learn these things. But that's not a part of the general education of doctors. So sometimes it's who are you going to turn to answer these questions? Also, it's just important to understand because the way that we interact with the medical field, understanding the history of that is extremely important. Specifically, gynecology, which if you don't know, gynecology is the medical practice that focuses on the female internal organs, external organs, so the vulva, the uterus, things of that nature. And so the profession of gynecology came about through racism is the truth of the matter, truly. It was created by a man named Marion Sims, and he developed all these findings of gynecology by studying enslaved black women, literally performing procedures on them without anesthesia, without anything to make it a safe thing or even somewhat bearable. It was just raw, just completely. That's how it is. And so all of those learnings have then just been passed down and through and up to gynecology as we know it today. There have obviously been more developments and more research done in more humane ways, but it all stemmed from racism, slavery, and a really crappy person. And that's important to know because a lot of people don't. A lot of people do not realize that that's how it came to be. And specifically, Marion Sims studied 3 specific enslaved individuals, Mary, Betsy, and Arcana. And that's how it came to be, through those 3 individuals having to endure horrendous things, all in the name of science, and one man. So that's something that sex ed will teach you that a lot of people don't get because who's going to talk about it? We know that history in schools is not set up to include the bad stuff. So where would you ever learn that? Sex ed is where you're probably gonna learn it, you just have. So yeah, if you want to learn more about that, shoot me a DM and I will share so much information. And then as you learn more about that, then you also see you learn the history in terms of birthing. You know how now there's been a rise in people talking about midwives and doulas and not having hospital births but going and having births in their home or birthing centers. Yeah, so that you would learn through sex ed that's how birth used to be. Before we industrialized and everything became what it is today, peoples was pushing out babies in their villages, in their communities, with the help of somebody who's done it many times, caught them babies, wasn't a doctor, they were midwives. And as, time progressed, colonization happened, slavery, all that jazz, birthing became medicalized. It became something that was taken away from midwives and given to white male doctors. That's what birth is today is not what it used to be. And so that's important to understand because if you recognize how it changed, how it shifted, and all the flaws within the medical field, then you can understand maternal mortality rates here in the United States, especially for Black women, BIPOC women in general. Yeah, so sex ed illuminates that, and that gives you a better understanding to make informed choices. Like, if you understand, like, hey, why is this happening the way it is? Like, what are the components that go into this? You can make a better decision on if you want to have your child in the hospital, or if you want to go and find a midwife and a doula, and do something that makes you feel more comfortable and more like you will actually walk away and go home with your baby. So yeah, sex ed does that, because also, you think a doctor's just straight up being like, yeah, so you're likely not gonna leave the hospital, let's go have a baby. No, sex ed though, sex ed will give you that. And another important aspect about like the medical field is understanding how it's centered. It grew from white men. So do you know who is like the study of the medical field? It's pretty much white bodies. That's why if you go and look in like medical books, you're not going to see different skin colors and things of that nature until like very recently. There have been like some more progresses in terms of that, but like generally they only researched white men. Everything was based off of white men. That's why BMI is bullshit. And that's also why there is not much known about the clitoris. Like, there's not. People just weren't researching it. It wasn't until just recently, I mean like within this past month, that it was publicly announced that the human clitoris has over 10,000 nerve fibers. If you heard before, like, oh, the clitoris has over 8,000 nerve endings, that was based off of a study of a cow clitoris. So like, the medical field has not been knowing. So it's like, how do you answer these questions about this? Sex ed is going to answer those questions, because the medical profession typically can't. They don't know. They don't know. They wasn't studying it. So sex ed is extremely important, friends. Also, sex ed, when it comes to the medical field, you can learn a lot in terms of like sex ed that focuses on contraceptives. And by contraceptives, I mean birth control. And that is from the historical standpoint, but also like how birth control works and like the different types of birth control. From the historical context, you can learn about the birth control pill and the very nasty history of that, and how it also led into the forced sterilization of a lot of women, Black women, Puerto Rican women. Yeah, that happened all in the name of science for birth control. Sex ed will tell you that, because again, history classes ain't gonna. Also, sex ed is gonna actually teach you about all the forms of contraceptives, not just like one or two. If you were getting good sex ed, you should know about every single birth control option there is available to people. Because chances are, if you go to a doctor, you're not going to get the full list. That's for a wide variety of reasons. If you're a BIPOC person, it's usually medical racism. And there have been a lot of instances where doctors only offer a handful of options to their patients because they feel that patients should be on a specific type of birth control, not considering like that individual person's body, their lifestyle, any of that nature. But they're like, yeah, you should do this because like, yeah, that's the best option for you. And those options are usually just LARCs, which are long-acting reversible contraceptives. So things like the IUD or the implant, which they are good for up to like between like 5 and 8 years, 10 if you get the copper IUD, as a way to like, you know, encourage people not to have children. So yeah, medical racism and birth control, it's another great aspect of sex ed is going to be the anatomy aspect. Like, good sex ed is going to teach you about the human body, because outside of folks who like take like in-depth biology courses and anatomy classes, only people that really learn about the body are doctors. So sex ed can help with that, because we should all know about the human body. We should all just understand how all human bodies work, because we interact with all people. It doesn't just matter on your body, it's everyone's. Because if you are someone in HR, if you don't understand what, you know, menstrual cycles and endometriosis is like, how are you helping to serve your employees that need specific like more sick days in terms of like their doctor's appointments to go for endometriosis and stuff like that. There's so many examples I could pull, but like, it's important for everyone to know these things, because we just should. And we know for a fact that everybody doesn't. Hello, I know y'all done seen them TikToks of people on the street being like, hi, can you tell me where the clitoris is? And people are like, no. Or, hey, how many tampons does somebody use over a menstrual cycle? And people are like, I don't know, 100? Or my favorite, there was a video of someone saying, can you pee with a tampon in? And everyone saying no. Spoiler alert, you can pee with a tampon in, y'all. there's two different holes. So like anatomy is extremely important, and you can learn that from sex ed. Also, sex ed is going to teach you about the menstrual cycle, which everyone should know about. Like everyone should have an understanding about, even if you don't have a menstrual cycle. Like everyone should have that knowledge to understand, because we all should have that. Also, because if you understand the menstrual cycle, you better understand how pregnancy happens. So like, you see how those things are like really important? They're so important. And because most doctors are not out here talking to people who don't have uteruses and periods about, you know, menstrual cycles and like how pregnancy happens, like, yeah, the moral of the story here is that we all need the information, and sex ed offers that information to everyone, not just some people. Well, when it's taught correctly, obviously, you know, in middle school, it's not taught to everyone. It's boys, you get to go to recess. Girls, I'm going to tell you what a menstrual cycle is. And then we have this discrepancy and like this misunderstanding. Also, it's important because if we actually have that understanding of the human body, and everyone understands it and actually knows, you know, all the parts of the vulva and all the parts of the penis, guess what we could do? We could better close the pleasure gap. Like if we actually understood, like, I understand anatomy, I understand the human body, I know the parts, I could probably provide some pleasure a little bit better. Mind-blowing, I know. And then the last piece about like sex ed in the medical field is understanding that there are diversified sex educators. And by this, I mean like there are sex educators that have medical backgrounds, but also understand sex education in depth. And this is like some great examples. Like there are some PT, some pelvic floor therapists that are are trained in sex education. Really useful for folks who experience like pain during penetrative sex, vulva pain during penetrative sex, and things of that nature. Or people who like after they have after they give birth are trying to get back into like having sex, but things are not going the way they did before. Like it's super important, like aspects of things that you would not think of, but are realities in terms of like continuously being a sexual being through different stages of your life. And then you've also got like occupational therapists who have backgrounds in sex education. I actually have a friend who's also working on their doctorate and has a background in occupational therapy, but it also has that sex education training, because there's a lot of things that happen. Like if you get into a car accident, how you get back into the groove of things, like how do you work your body, like there's so much. So diversifying the sex educators that you learn from that have medical backgrounds is also really crucial and an important thing to do. And I'm obviously going to share some recommendations this week on social media, so you definitely want to follow. But the moral of the story here is that the medical field, it's lacking in terms of like sex ed. So sex ed as a standalone is going to supplement the things that the medical field does not give you as like a patient, and doesn't give its doctors in terms of like their education. So yeah, sex ed is important. It's important. It's important. But you already knew that. But yeah, make sure you are subscribed to this YouTube channel. Make sure you are following me on all the social medias, and just subscribe to my email newsletter. And make sure you come back next week, because of course it is my favorite topic, how sex ed is a pillar of social justice. But until then, I'm gonna see you later. Deuces.